Hello, my name is Kate Panzer.
Hello, my name is Julia Shields. Today, we will be presenting on the topic of developing deaf-friendly physicians, an American Sign Language elective for medical students.
And just a little bit about us. Again, my name is Kate. I use she, her pronouns. I'm hearing. I'm a second year medical student at the University of Michigan. And for this presentation, I'll be communicating in English.
Again, I'm Julia. I use she, her. I'm deaf. I'm an ASL teacher, and I will be communicating in ASL. Now we're going to discuss the topic of healthcare access for deaf patients. We have two parts, challenges and solutions, and I will elaborate on both of them. First, some of the challenges include language and culture that are often different from the healthcare team. This often leads to communication barriers. There is also a lack of deaf, health, and medical education. For example, if a deaf patient comes to the hospital, it can be very frustrating if the doctors and nurses don't know how to sign. Or how to communicate with deaf patients. That's a communication barrier. Now, how do we solve this problem? Our team here at the University of Michigan Medical School decided to offer an ASL elective for medical students to establish a basic foundation for future physicians to work with deaf patients. Still, it's important for these students to remember why they always need an ASL interpreter present.
So, to talk a little bit about the ASL elective for medical students, for logistics, the class was first offered in the fall of this past year in 2021, and it was a 10-week course. The course was led by a certified ASL instructor, Julia, and the class met twice a week. On Mondays, met in person, and Wednesdays, it was virtual via Zoom. Topics that were covered included basic American Sign Language, discussions about deaf culture, and introduction to medical signs and vocabulary. We also had guest presentations, including a deaf patient panel and an ASL interpreter that all shared their experiences and perspectives.
Now we will discuss our results. When we first offered the ASL elective, we had 44 students sign up. Ultimately, this went down to 22 students who enrolled, and they learned many, many signs and terms. For evaluations, we had three components: attendance, homework, and the final exam. Both the homework and the final exam tested receptive skills, not writing in English. Lastly, for assessments, we distributed a survey to ask the students how we can improve the course for the next semester.
So in conclusion, our first ASL elective here at the University of Michigan was a major success, and we were so excited about it. And we learned a lot of lessons along the way that we hope to use to improve the course moving forward. So for the future, we're actually offering an ASL level 2 this spring of 2022. And we're really excited to have the support from the Department of Family Medicine here at Michigan Medicine to ensure that this course continues and engages several medical students along the way. If you're interested, want to contact us with any questions or curiosities, feel free to email us. We've included our contact information here, and we're excited to connect with you. Thank you so much.